I mean, I can give an example of the environmental factors. We are in a health crisis, and we brought it on ourselves by bad practices. And one of the things I write about in Hormone Secrets is the diet. And the diets that we're eating are high carbohydrate. They've been encouraged by the industrial food manufacturers. And we have an area the size of California devoted to corn cultivation, which is primarily used for sugar and sugary sweets and all that stuff in the United States, an area the size of California in the United States devoted to corn cultivation.
And now, Verbal Artwork Podcast with Mr. Rembrandt.
This is another episode of Verbal Artwork with Mr. Rembrandt, and I'm Mr. Rembrandt, and I have a special guest here today, Mr. Robert. And could you say your last name? I don't want to butcher it.
Yoho.
Yoho. Okay. So, Mr. Yoho has a background in the medical field, and I'm just going to give a brief synopsis, a small breakdown, and then I'll let Mr. Robert introduce himself. So Mr. Robert was born in Richmond, Virginia, and he's grown up in Ohio. And he has a very interesting background in which he was an athlete. He took wrestling as a senior, been to a very good university for medical school. Mr. Robert also has had a small stint in being a master climber. We may get into that for a little brief minute. And also he has some experience in karate and being a bodybuilder. He seems to be married and has some beautiful children. The most interesting part we're going to get into is Mr. Robert's opinion and experience and his analysis of what's going on in the current medical field, how this affects and interferes with our life. Mr. Robert has a book in which we'll get into during this podcast, in which he talks about a lot of alarming things that he noticed and then that he has experienced in the medical field. So I'll let Mr. Robert give, if you can, give a brief synopsis of you and your background, and then we'll go from there.
Well, it's so nice to be on your podcast, Rembrandt, and you can call me Robert. We don't have to do any misters here. Of course, I'm a physician, but I'm retired, so you don't have to doctor me anymore. Okay. So I was finishing up my career. I'm 68 now, and I was finishing up my career, and I fell into this rabbit hole of medical corruption, and I started studying it. So for the past 4 years, I've studied the problems in our healthcare system. And I published a book called Butchered by Healthcare, that's as dramatic as I could make it, about the problems, and another book subsequently. My primary interest now is the disease that's on everyone's mind, the viral problem, and we are sort of in a tremendously difficult time with this, and that's what I'd like to talk about the most. But before we go there, what questions do you have? And I'll call you Rembrandt if that's okay, since we don't have to be Mr. and whatever, less formal.
Yes, sounds great. So I want to start off with talking a little bit about the healthcare first, and then we can go more into the illness of concern, which is probably on everybody's mind currently. So why did you want to write about, in more in depth, the corruption in the healthcare industry? Usually individuals who are in the medical field are kind of pioneers, and they usually support the medical industry undoubtedly. So what makes you want to talk about the corruption?
This is an oddball story, but I was a cosmetic surgeon for the last 30 years of my career. I did liposuction, breast augmentation, and all that crazy stuff. And during that period, as I aged, and by the time the end of my career came around, all my patients, who were 85 or 95% women, they were entering the change of life, or the menopause. And so I got interested in that, received training, and started treating my patients for, the change of life symptoms, which turn out to be bad for their health. And the hormones that you can use to treat these things are tremendously good for your health. And just to give you a clue about that, Alzheimer's, which is the most expensive disease in America, could be 85%, 80% prevented if all these women would get on estrogen. And I know that's hard to imagine, but in my other book that I wrote about this, called Hormone Secrets, which you can see on your screen, I've got an appendix with 75 references about Alzheimer's. So it's not just feeling better, having less hot flashes, having better sexuality if you take these hormones, but it's life extension, feeling better all the time, and so on. It's a huge difference. And I found that the medical establishment had run these things down. They put these scary warning labels on progesterone and estrogen and testosterone. And so I went down that rabbit hole and got more interested in that, and found I thought I'd find a can of worms, but I kind of found a dumpster full of worms. There is a big money going around, and these drugs cannot be patented, so they're not tremendously profitable for the drug industry. So they've run these things down in favor of drugs that don't work as well. And then I progressively started to study the insurance industry and the different medical specialties and all kinds of things. And I finally, I got so into it that I wrote Butchered by Healthcare, which is, so it's not a profitable venture, Rembrandt. It's a passion project, and I've been working on it for 4 years full time.
Well, that's good. Yeah, I can see by I talked to a few individuals about you before you've come on the show, and when I told them about the title of your book, it's always seemed to surprise the individuals who I was talking to. They see, wow, what a name.
It's meant to be inflammatory, the subject is inflammatory.
Yes, because they were thinking like, well, from a marketing standpoint, what was he going for? And there's definitely a shock factor, more so than probably you're looking for sales necessarily.
It's an expose. It's very hard to get sales now. 4,500 books are published every day on Amazon. And this thing, with the marketing and advertising, after a year, it sold 2,000 copies. So it's not a big seller, but I have grateful readers, and I have my fans.
Yes. Yeah. So in the book, you go over a lot of different topics, and writing about the healthcare corruption is one of them. And I'm pretty sure you, as we go along, we're going to learn a lot of different things, because especially just now seeing that you said 80 to 85% of Alzheimer's could be preventable, which
that's hard to believe. That's hard to believe. That's not commonly understood. And that's why I stuck 75 references in the back of Hormone Secrets, printed in the book. So we don't have to go into that, but that's a teaser for this information that's in Hormone Secrets. It's probably, that's one study says 80%. Other studies are not quite as good, but Alzheimer's is a tremendous problem. And if even a third of it is prevented by taking estradiol or estrogen, it's a huge, huge thing. And the information is being withheld from us for economic reasons.
Do you believe, this is kind of a side question, but do you believe, because it's my belief, as well as other people I talk to, it seems that like a lot of casually contemptuous conclusions when it comes to people in the medical field is everything is just hereditary. The disease you have right now, it's hereditary, and what you're going through right now, it's hereditary. But can you say that like a lot of it has to do with behavioral aspects of food they eat, exercises that they've done, habits that they've had as a childhood, and like you said, preventable aspects that could have been taken to prevent something such as Alzheimer's?
Yeah, I mean, I can give an example of the environmental factors. We are in a health crisis, and we brought it on ourselves by bad practices. And one of the things I write about in Hormone Secrets is the diet. And the diets that we're eating are high carbohydrate. They've been encouraged by the industrial food manufacturers. And we have an area the size of California devoted to corn cultivation, which is primarily used for sugar and sugary sweets and all that stuff in the United States, an area the size of California in the United States devoted to corn cultivation. And so these recommendations for these high carbohydrate diets have been swirling around for about 30 years. And they seem to have been promoted by the big industrial food groups, right? And because they can promote sugar, and they can promote kinds of fats that are easily storable, and it tastes good. And so what's happened is, I believe that this is directly responsible for the obesity epidemic. Okay, so right now the science seems to be moving towards animal fats and much higher fats diets. And you probably heard of this ketogenic diet. That's a diet primarily of fat, and they do very well. They get rid of the diabetics often get rid of all their medications, and they throw away their blood pressure pills. Their weight falls. And this is animal fats and a high fat diet, as opposed to this last 30 years kind of insane narrative pushed by the industrial sources of our food that the carbohydrates are better. And it's done in conjunction with the FDA, right? The FDA is entirely captured by the industry, both the drug industry and the food industry. And they get their revenues from these sources, and they basically are advertising vehicles for industry. And so it's been a tremendously bad thing for our drug supply, and the integrity of our prescription drugs and our food. And our health has reflected this, and this unprecedented obesity epidemic has, the industry and the FDA has been directly responsible for it. So this is a area where it's definitely environment.
Yes.
And it's a problematic. It's horrible.
I noticed, which a lot of my watchers don't know, what I've previously done for work, but I have worked for the government, and working alongside of people who've worked with lawyers and inside the jail industry and worked with judges. And one thing I noticed from conversations with them and the information they've showed me is that, like in jail systems, a lot of the individuals who go in there and become inmates, they start off as generally good health, and a lot of them over time actually become diabetic in the jail system while they're there. They start off fine, and next thing you know, depending on their sentence, a year or two later, a lot of them become diabetics.
Bad diet.
I don't, because obviously no exercise, not a lot of opportunity for sunlight, air, exercise, and then the food is just a bunch of preservatives and carbohydrates. It doesn't really have much nutritional value at all. And then even when they order things such as Canteen, for example, it's vending machine food.
Oh,
chips
God.
And so there's not a there's really sorry, I didn't think you were going to react that way, but it's really bad. They don't have a lot of opportunities for different healthy foods. So diving a little bit further in your book, second of all, you don't how much negative attention have you received because of you speaking out the way you do?
Rembrandt, I'm obscure, and basically nobody's hammered me. The other thing is, the physicians all know something's wrong, and when they read this book, it confirms a lot of their suspicions.
Yeah. even what's going on, for example, for the illness that everybody's concerned about, the viral illness, it is after a year and a half of this, there's a lot of information that we do know. Okay, we know the effectiveness of masks. We know, which is not very effective, to be honest. We know the effectiveness of the different measures that are in play, and it doesn't seem to have a whole lot of affect the way that the government says or projects or makes a claim that it does. But still, majority of the population, especially institutions, people like governments and even medical professionals, seem to just keep pounding the same rules that you need to wear a mask, you need to wash your hands, and everybody should just get the shot. Some people rather call it a shot than a vaccine because it doesn't eradicate disease such as chickenpox vaccine for the Zooster virus. But and I notice having conversations with people in the medical field or in governments that push all of these narratives on what we should do. When you get into a conversation with them and you ask them deductive questioning, they all agree on the same information. But yet the way we should go about it, they feel is one way, and then the way a lot of people in the public feel that we kind of should just do more behavior of going back to our regular life. So the information is not ambiguous, but the way people feel like we should respond is different. So so you think the medical field and the institutions have, it's apparent that they have a big play into why that is. But what's in it for them? Like, what's in it for them to, I also do real estate. I worked in the real estate industry. They had moratoriums for over a year where they were saying we can't evict anybody because of this crisis, which it didn't seem to be correlated together. Also, the restaurant industry was hit very hard, which I guess a lot of transmission can be done indoors, do we know? But they wouldn't even let restaurants open up their patios for the course of a year to let people even eat outside. I mean, you can't eat outside. I don't see why that's a danger of large amounts of people dying by eating outside, even if there is an issue going on medically.
So you're in the same state most everyone else is, and that the whole thing seems incredibly irrational. It doesn't make any sense, and you can't figure out how it ever came to pass. And in order to take your listeners through this thing, I think we ought to stick with the medical stuff, and then we can branch out and go more global, because it is a global problem. And your listeners are going to have to do some reading from I've got a document you can stick in the show notes or on your website or whatever.
Yes. And
they can go through this. It's going to take them hours, but let's see if we can accomplish a few things today in an hour or whatever we have. So about the vaccine, right? Yes. In the hospitals, even the janitors know a few things, right? And it's totally apparent.
I'm glad you've been watching this video up to this point. I had a great episode with Dr. Robert Yoho. I want you to continue to watch this video. Please continue to watch this video. But because of censorship, ambiguous YouTube guidelines, speech being under attack, the full episode will have to be on patreon.com/verbal artwork. The link will be on the description. Even though Patreon is a paid subscription service and I have multiple tiers for paid subscribers, this episode will be completely free. Again, this episode will be completely free and you won't have to be a member. So go there to watch the full clip of this episode.
This is just the short version. And obviously, of course, you can listen to this episode on anywhere you get your podcasts, Spotify, iTunes, Google, and others. The full episode will also be there to listen, with ads, of course. Also on the YouTube channel and on my Instagram, I will have short clips from this episode that you can watch and enjoy. You can go over to my Instagram at Mr Rembrandt, no spaces. Thanks for watching my video. See you on the next video, YouTubers.